Hi, I'm Helen Woodrow.
And I'm Amy Rush.
And we're both highly specialist speech and language therapists working at EG Training and Speech and Language Therapy.
This vlog is part of a series of vlogs that we've created to tell you more about the specialist speech and language therapy services that we provide.
This presentation is all about the specialist speech and language therapy techniques that we can use to support people with Down syndrome to speak, eat and drink more effectively. This vlog is number 7 in our series. We can provide advice, support and techniques to use with your child at any age. The techniques will help with good oral development for eating, drinking and speech. There are lots of simple techniques to help with breast or bottle feeding, using a cup or a straw, introducing a spoon, introducing chew foods, and also helping develop clear speech sounds. For older children and adults, there are lots of therapy activities that can help to improve eating, drinking and speech skills. So it's never too late to start. And there are lots of techniques that can be used with babies and young children. In vlog number 12, I'll talk more about working with babies with Down syndrome. The two key areas that people with Down syndrome usually experience difficulties in are low muscle tone and reduced sensory responsiveness. Low muscle tone means that the movements for speech, eating and drinking are more difficult to do. Let's think about low muscle tone and the jaw. Low tone means that you will have a low jaw position. Low jaw position means your mouth will be open. A low jaw and an open mouth means that your tongue can fall forward and protrude from your mouth. A low jaw position, an open mouth and tongue protrusion means difficulties with speech, eating, drinking and saliva control. So working on the jaw and developing a higher jaw position is really important for developing good speech, eating and drinking skills. Let's think about low muscle tone and the lips. Low tone means difficulties in closing or rounding your lips. This can lead to speech difficulties with sounds like b and p, and oo, o and w. It can also lead to difficulties in using a spoon, which would need to close your lips on, and a cup, or using a straw, which would need to round your lips on to drink effectively. Let's think about low muscle tone and the tongue. So low tone normally means the tongue protrudes forward in the mouth. Tongue protrusion means difficulties with speech, eating and drinking. Many people with Down syndrome have difficulties with chewing. This is partly to do with the jaw, but mostly to do with difficulties in making the tongue movements needed to support chewing. Developing lateral or sideways tongue movements is key to effective chewing. Try eating while keeping your tongue still and you'll see how important the tongue is for moving food around the mouth to chew it. The other area that is affected by low muscle tone is breath control. Having low muscle tone in your abdominal muscles means that you'll have reduced breath control. Reduced breath control means difficulties in using longer words and phrases in speech. Reduced breath control can also mean difficulties in controlling your breathing when you're swallowing, which can lead to choking, especially on liquids. The other key characteristic of Down syndrome that I mentioned is reduced sensory responsiveness. Reduced sensory responsiveness means that a person may not be able to feel food or drink in their mouth. It also means that they won't get feedback about the position of their mouth when speaking. It's a bit like trying to eat, drink or speak after you've had a dental anaesthetic. Increasing sensory input in the mouth and on the face can really help to develop the movements needed for eating, drinking and speech. This is vlog number 7 in a series of vlogs. So please check out our other vlogs for more information on the tongue, the lips, the jaw, breath control and saliva control. We also have vlogs like this one looking at autism and cerebral palsy.
Thank you for watching. We hope you enjoyed that and found it really useful.
Don't forget, this is just one of a series of vlogs, so please do check out all the others as well.
And to get a lot more information, please visit our website at www.eg-training.co.uk.